Well, this is just kind of a vlogging. I was in fact reading this book, Comprehensive Pharmacy Review by Shargel, and this book is basically uh, the, for the students who are trying to, doing their registration as a pharmacist in foreign countries, specifically in Canada and US, I think. I was just going through this book, and specifically I was in chapter 31, which is coronary artery disease. So right now I am reading this segment which is called Angina Pectoris, and I just want to kind of recording myself what I am learning from here. So first of all, if I want to define angina pectoris, what angina pectoris is, what is written here: the term angina pectoris is applied to varying forms of transient chest discomfort that are attributable to insufficient myocardial oxygen. So what does it mean? It means that angina pectoris is obviously a chest discomfort, and that chest discomfort is basically due to the insufficient oxygen supply to the myocardial level, and obviously it's transient. It's not like a permanent one. It's a transient chest discomfort, which is basically because of the insufficient oxygen supply to the myocardial level. So it is basically it's a kind of a symptom, or it is called a clinical syndrome, which is characterized by discomfort in the chest. So there are a couple of places where that kind of discomfort may appear, like chest, then jaws, then shoulder, then back, and obviously arms. So these are the points where this kind of discomfort may appear. Obviously this discomfort will be transient and attributable by the insufficiency of oxygen. And another thing is that this kind of discomfort or chest discomfort usually aggravate with the exertion. I mean, if anybody do any kind of exercise, if he's a patient of angina pectoris, definitely that pain will aggravate. I mean, exercise induced oxygen demand. That's why that pain happens and sometimes aggravate. And this kind of pain or chest discomfort can be resolved by initiating nitroglycerin. So another point is written: angina can occur in patients with valvular heart disease. So at this point, this chapter is stating that angina pectoris is much common with the patients who are having valvular heart disease. I mean, the patients who are having some kind of disorientation or some kind of problem with their heart valves, and also the patients who are uncontrolled hypertensive. And at the same time, it may also appear in certain non-cardiac areas, like, as I have already said, valvular, which is related to the heart valve. That means it is related to the heart, as well as hypertension. That means it is kind of cardiac issues. But there are some other places where this is not related to the heart or cardiac itself, like chest wall, esophagus, or even lung, that may also suffer from this kind of transient chest discomfort because of the oxygen insufficiency. So if we talk about the common causes, what is written here: atherosclerotic lesion that produce a narrowing of the coronary arteries are the major cause of angina. So basically this is because of the narrowing of the blood vessel which covers the heart itself. I mean, heart itself as an organ, it needs its own supply. I mean, it requires its own supply to keep its own cells alive. So the blood vessels, which is responsible for distributing that blood to the cardiac muscle itself, those blood vessels become blocked, or sometimes because of the deposition of plaque or deposition of fatty substances, that blood vessel will become narrow, and it will ultimately contribute to the insufficient oxygen delivery at that point. So atherosclerotic lesion that produce narrowing of the artery are the major cause of angina. However, tachycardia, anemia, hyperthyroidism, hypotension, and arterial hypoxia can also cause oxygen imbalance. There are many other causes, but the main causes is the atherosclerotic lesion that ultimately blocks the blood vessel that itself supply the blood to the heart. So if we talk about the types, there are a couple of types, I would say. How many types? Okay, there are four types, I would say. So first one is stable angina, which is sometimes called classic angina, stable angina, and definitely the second one will be unstable angina. So these are the common terms we used to know. Like angina means two types, stable and unstable. Now what I am learning from this book is that there are another two types, which is called angina decubitus. Very interesting. Angina decubitus, nocturnal angina. The fourth one is prismental angina or vasospastic or variant angina. So what I have learned from here, there are four types of angina. One is stable angina, second one is unstable angina, third one is nocturnal angina, and the fourth one is variant angina or vasospastic angina or prismental angina. So prismental angina is having some synonyms. Number one is prismental angina itself, second one is vasospastic, and third one is variant angina. And nocturnal angina, it is having two similar names. One is nocturnal angina and the second one is angina decubitus. Unstable angina, it is not having any additional synonym, but stable angina, we call it sometimes classic angina. So again recapitulating, four types of anginas are there. Stable or classic angina, number one. Number two is that unstable angina. Number three is nocturnal angina or angina what is that? Decubitus, angina decubitus. The fourth one is prismental angina or variant angina or vasospastic angina. Yeah. So these are the four types of angina. So I think for today it's short and sweet, just defining what is angina and what are the classifications. In the next class I will try to try to educate myself about these types, like the types of angina itself in thoroughly. So recapitulating, angina is kind of a chest discomfort which is mainly attributable by the insufficient oxygen supply to the cardiac muscle or specifically to the myocardial level. uh, mm, yeah, obviously it is a transient chest discomfort, and sometimes this chest discomfort may happen because of the narrowing of the blood vessel at the coronary level, and it sometimes causes discomfort to the non-cardiac organs like in the chest wall, in the esophagus, but mainly it causes pain, I mean discomfort to the patients with uncontrolled hypertension or the patients who are having valvular heart disease. So this is kind of a clinical symptom which is characterized by the pain or discomfort at the jaw, then chest, then shoulder, then back, and also the arms. So the common cause is basically already I have discussed, narrowing of the blood vessel because of the plaque or atherosclerotic lesion, and sometimes many other causes like hypotension may also contribute in anginal issues, tachycardia, anemia, hypothyroidism. These are also certain causes for angina. By type, angina is of four types. Number one is a stable, number two is unstable. Stable one we also call it classic angina. Third one is nocturnal angina or angina uh, decubitus, and the fourth one is prismental angina, prismental vasospastic or variant, prismental vasospastic or variant. Third one is angina decubitus, angina decubitus. So okay, I think it's quite good enough for today. So hope to see you in the next class.